Let's just go down what Obamacare has now, and if you give me a stay go, keep it or not keep it. So would you keep the individual mandate now?
No, I don't think it's enforceable. Now, I have my own health care plan.
Would you keep the federal exchanges?
I think exchanges are good, but I don't think you need to have a federal exchange. I think it's possible to have a private sector exchange so people can shop just like they can for insurance. But let me, before we go through all the, one thing I would say that I support in Obamacare, and we should have done, and I thought we had achieved a lot of it, but we hadn't, which is you shouldn't be able to lose your health care because of a pre-existing condition.
I was going to ask you about that.
So that's really, really critical.
Keep that.
Yes, but I have my own program here, and my own program we're starting to carry out in Ohio, which I think is scalable in the country, and that is to incentivize a primary care doctor to work with both insurance companies and providers to treat people to keep them healthy. So the primary care doctor becomes a shepherd, and as you walk through the system, instead of going to a hospital and getting 10 tests when you only need 2, you go to the hospital and get 2 tests, or like in our little city of Columbus, not little city, but big city of Columbus, we have the hospital, Children's Hospital treating asthma, and they figured out a way to have protocols to keep children out of the hospital, which means the hospital gets less revenue, the insurance company has more profits. They share the benefit of kids being healthier and not being hospitalized. In other words, this whole business of why don't we switch medicine from quantity to quality? Why don't we reward all the parties in there to make sure that we get the kind of health care we need, the quality care we need at the lowest possible price? And that's the way most things in the 21st century are working, except somehow, this Obamacare was a terrible, terrible decision.
And how much of Obamacare touches what you just described?
It doesn't do that. It doesn't have anything to do with controlling costs. It's driven up health insurance costs. It's a top-down approach and doesn't rely on the market. What it does is says the market is flawed, so we're not going to make the market work better. We're going to substitute government for managing the market. That never works in the United States of America. So I'd rather have a market-oriented system. And just to give you an example on this, Major, by taking a Medicaid program that we've had, we've been able to significantly reduce the costs of that program by using common sense and innovation to be able to cover more people with prices of Medicaid going down because of innovation and the things we do to deliver better services. Somehow we've gotten to the point in government where we don't think government can be made to work better, and I don't agree with that. Government can be a lot more effective and a lot more efficient.